Hi, my name is Margreet Stegeman. I'm a gynecologist. As some of you might know, normally around this time of year, we have our Women's Health Evening. And yeah, for obvious coronavirus reasons, that is not happening this year. So we thought that we would do this in educational videos, and I hope you still enjoy that just the same. I am going to start off talking about the menstrual cycle, and then especially in relation to ovarian cysts. I get a lot of referrals for women that have been diagnosed with ovarian cysts or who have had ovarian cysts in the past. And I hope that at the end of this talk that you will understand that that actually happens quite regular in your own menstrual cycle, and that puts it a bit more in perspective. So the ovaries are two almond-shaped organs on the side of the uterus. This is the uterus, the womb, and these are the ovaries on this side. And they have two functions. One of them is to release an egg, that is the ovulation, and the other one is to make hormones, estrogen and progesterone. And we'll talk about that a little bit further. Now, this is the tube, and when the egg is released, the fimbrial end of the tube will catch the egg and then transport it through the tube to the uterus, where it can implant into the endometrium if it has encountered sperm in the tube and has been fertilized. So if the egg is fertilized, then it can implant in the endometrium here. If the egg is not fertilized, then the implantation doesn't happen, and then you get your period. And the blood is coming out then through the cervix here, and then also through the vagina. In all these pictures that I look up, they draw the vagina as this tiny little tube. The vagina is a bit longer than that, and that is where your blood comes out. This is a picture to show what happens schematically in the ovaries with an ovulation. So a normal length of a cycle is between 24 to 35 days, and that is built up from the time of ovulation till your period. That is called the luteal phase. That time frame is practically consistent and is 14 days. The time from a follicle starting to ripen to ovulation, that is a more diverse time frame, and that can be anywhere from 10 to 21 days, and that is called the follicular phase. So if you add 14 days to the 10 and 20 to 21, you get a cycle that is anywhere between 24 to 35 days. So if your cycle is anywhere between 24 to 35 days, you are most likely ovulating, especially if it's a regular occurrence. When the egg grows, so in the first 10 to 21 days, that egg produces estrogen. And the estrogen builds up the inside lining of the uterus, which is called the endometrium. After ovulation, the ovulation cyst that stays behind, this is what we call the corpus luteum. That cyst makes progesterone that ripens out the endometrium so that it gets ready for an implantation if an egg is fertilized. Again, if the egg is not fertilized, if you don't fall pregnant, the endometrium sheds, and that is your period. So schematically here, we can see what happens in the ovaries here. And schematically here, this is the effect that it has on the endometrium, the inside lining of the uterus. So the first 10 to 21 days, you get a follicle growing that produces estrogen. You get your period first, but as soon as your period is finished, the estrogen starts building up the inside lining again. You ovulate, you get a release of progesterone, and the progesterone ripens out the endometrium to get it ready for an implantation of a fertilized egg. And if that doesn't happen, you get your period. Now, what is the relationship with a cyst? A cyst, the definition of a cyst is a fluid-filled cavity. So seeing that every month you make a follicle, and that is called the follicle that goes and ovulates is called the dominant follicle, and you grow one of those on your ovaries every month, and by definition that is a cyst because it's a fluid-filled cavity whereby the egg is sitting in that fluid-filled cavity, and when you ovulate it releases the egg. The dominant follicle usually grows to about 2 to 2.5 centimeters and then it ovulates. Now, common things that can happen with the dominant follicle is one of the things that can happen when you ovulate. There can be a rupture of a vessel in the follicle, and that can cause a bleed, and that can make that follicle bigger than, and up to 4 centimeters is not uncommon. If the balance of the hormones is not there, then that dominant follicle isn't ovulating, and then it can persist and become bigger, and that is called an anovulation. Usually these enlarged follicles, or if you want to call them cysts, disappear within 1 to 2 months. So they disappear by themselves. So a better way to make that distinction between a follicle and a cyst, and not to worry women about whether that cyst is normal or not, is to reserve the cyst on an ovary if they get larger than 4 centimeters, and if they are smaller than that, we should talk about follicles. So every month you make a cyst on the ovaries, and that is called a dominant follicle. A dominant follicle will ovulate around 25 millimeters. If the balance of the hormones is not there, you get an anovulation, a persisting cyst that can get bigger. If there is a bleed in the cyst, we call it a hemorrhagic cyst, and that can also be a bigger follicle. What can you then see on an ultrasound? So normal pictures on an ultrasound is what you see here. This is a normal ovary with little follicles. This is probably a follicle that gets a little bit bigger and could become the dominant follicle. And once it gets to 2 to 2.5 centimeters, it might look like this. If there is a bleed in there, then the cyst can become even bigger, and then it becomes a little bit grayish, and sometimes has septations in it, and sometimes has that grayish end septation in it. So these are the ultrasound pictures that you can see. What symptoms do cysts give? Well, most of them don't give any symptoms at all, because as we said before, you make a cyst on your ovaries every month, and not everybody is bothered by the ovulation cysts. Some women do feel ovulations, but most women actually don't. So symptoms of cysts, most likely nothing. But if they get larger, they can give pelvic pain, or they can give a fullness or heaviness, and sometimes they can cause a bloating. Complications of cysts are rare, and they're usually only if the cysts are bigger. So if they're bigger than 5 centimeters, then they can make the ovary taut around its pedicle, and then there is no blood supply going to that ovary, and that gives severe acute pain. But it is actually only with the cysts that are bigger than 5 centimeters. So the types of ovarian cysts, there's 2 main types that are the functional ones, the ones that we have seen part of the menstrual cycle. They're harmless, short-lived, and they are the most common types of cysts on the ovaries. Then, of course, there are the pathological ovarian cysts, which is the abnormal cell growth, but these are much less common. And then there are still cysts that are caused by underlying conditions such as endometriosis, which can cause endometriomas on the ovaries, which are cysts with a certain characteristics on the ultrasound. Incidence of ovarian cysts, well, actually we make a cyst every month. We've talked about that now, but more importantly, about 1 in 10 women will have surgery during their lifetime for ovarian cysts. So it's quite common in that sense as well, that you need to get surgery for that. Risk factors are, If there are hormonal problems, so if the balance of the hormones is not there, then you have a higher chance that you'll get an anovulation and that the cyst persists and becomes bigger. Pregnancy, the cyst that is there after ovulation makes the hormones to keep the inside lining of the uterus intact for a pregnancy to implant in. And that cyst will have to take that function on for quite a bit of weeks until the placenta takes over. So you need a cyst on the ovaries to keep your pregnancy going. It becomes an issue if that cyst becomes bigger, let's say about 5 centimeters. So as said before, endometriosis can cause cysts, a pelvic infection can cause cysts. And if you've had previous ovarian cysts that needed surgery or needed more attention, you have a higher chance that that might happen again. The investigations that we do, we take a thorough history and an examination. We do an ultrasound scan, but as said before, it usually happens the other way around. So an ultrasound will have been done and a cyst is found, and that's how you get to your GP or to your gynecologist. An ultrasound is a probe that is placed inside the vagina, and then the uterus and the ovaries can be scanned. If there is a cyst, you can do a repeat ultrasound scan in 6 to 8 weeks, or if you're a GP and you don't trust the aspect of the cyst, then you could refer to a gynecologist. And if it's then not a simple cyst, then we do a blood test, which is called the CA125, which says a little bit more about what kind of a cyst we are dealing with. The treatments depends a little bit on the size and the appearance, symptoms, and also very importantly, whether you're postmenopausal or not. As discussed, when you're still having periods, the ovaries make cysts very often, but when you're postmenopausal, your ovaries should actually be quiet and not make any cysts at all anymore. So if there is a cyst and you're postmenopausal, that is more worrisome. Most cysts are treated conservatively. We rescan them 6 to 8 weeks later, and you have about a 95% chance that they will have disappeared. Occasionally, we will have to look at them if they are large, or if they give symptoms, or if they are potentially cancerous. And then preferably, we will do that laparoscopic or keyhole surgery. It is a completely different story if the cyst is large, over 5 centimeters, or has aspects on the ultrasound that point out more that there could be cancer or a malignancy happening. So if there's thick septations, if there's nodules, if there's more blood flow, if there's solid areas, and if there's free fluid, and then we're talking about a lot of free fluid, because that's another thing. On ultrasound, we very often get people worried because there's a bit of free fluid. A bit of free fluid is pretty normal. It gets different if there's a lot of free fluid, and then we call that ascites. So if we think that there could be ovarian cancer, we definitely do a CA125, and then we perform what is called a malignancy index. The malignancy index is based on your CA125, the findings of the ultrasound, the characteristics of the cysts, and whether you're pre or postmenopausal. Then that gives a number, and if your number is high enough, we have a high suspicion that there could be ovarian cancer, and then a referral to a gynecological oncologist will happen, who most likely will do surgery via laparotomy, although there are so many advances nowadays. They might do this laparoscopically as well. They will do remove the uterus, remove ovaries, take sampling from the obvious areas where there are metastases, and will remove any deposits that they can to give you the highest chance for survival. In summary, what I want to say, and I hope that that is clear, that is the story or the message from this talk. Most ovarian cysts are benign and self-limiting. Now, if you have made it this far, thank you very much for your attention. And there will be more videos coming in the next couple of weeks on our Shepherdham Women's Health site. So yeah, please keep your eyes open for more information.